Hello, and thank you for joining us for this week's edition of It's Your City. I'm your host, Courtney Bloomer. Today's edition is brought to you by Paradise Salon, Spa, and Wellness, providing first-rate spa services right here in Carson City. Our guest this week is Dr. Johnson, the director of Carson Tahoe's Wound Care Center. Welcome, Dr. Johnson.
Hello, Cortney. Thank you for having me.
All right, Dr. Johnson, you're here today to talk with us a little bit about the Wound Care Center, but specifically about Diabetes Awareness Month, which is happening right now, November.
Yes. Diabetes is a really important part of what we do. In fact, 75% of the people we take care of have diabetes. One of the funny things about wound care is that people think that we take care of wounds. Really, we take care of diabetes and the patients and all of the problems that they have with that diabetes care as well. So as far as the Wound Care Center Diabetes Wellness is concerned, it's extremely important to us to make people aware of what can happen with diabetes as it pertains to their feet, to their legs, and to other parts of them that would eventually end up with us in the Wound Care Center.
That's right. So diabetes is an illness that affects a very large number of Americans, sometimes related to some lifestyle factors. Tell us a little bit about diabetes.
Diabetes is an interesting disease. For the most part, we attribute some of it to their lifestyle. A lot of it is very much genetic in nature, and their lifestyle just contributes to it. There are so many people in this country that suffer from diabetes, and actually their diabetes process and the problems that are happening to their body goes on for almost 10 years before they actually become diagnosed with diabetes. And a lot of those problems are so slow in developing that people don't notice them until they're serious problems. So for instance, with us, a lot of people suffer from neuropathy, which is a numbness in their feet. Well, that neuropathy, which is a problem of the nerves in the body, isn't just affecting their sensation of their feet. It affects their blood vessels, it affects the shape of their feet and the muscles in their feet as well. And slowly over time, those feet start to change shape. They can't feel things that are happening. Their skin quality changes because of diabetes. And then they get a sore, and sometimes they don't even know it for weeks at a time. And then they have these sores that they just can't heal. So all of those factors compound, but what's so important about diabetes awareness and people knowing that those things can happen is it is much easier for us to prevent those problems than it is to fix them later. And even beyond that, when they do have the problems, the sooner we can make them aware that something is happening to their feet, the sooner we can intervene, and the better chance we have of actually saving their feet. Now, just having sores is a little part of our problem, but it's not the main crux of what we do.
Right, something's causing those sores.
Absolutely, they're diabetes underneath. The burden of what's happening here, though, is that when you have those diabetic foot wounds, that raises their risk of amputation significantly. And they run about a 45% chance of having an amputation once they have a wound. And once you've amputated a limb in that population, their 5-year survival is about 50%. So treating diabetic foot wounds is limb salvage, and it's life-saving as well. Those things, that's what we really do in the Wound Care Center. But those underlying problems are so slow and so quiet that unless somebody, a professional, is checking those feet, looking at them, teaching you how to check those feet and take care of them, those things will creep up on you, and sometimes it's really hard to save after we've passed a certain point.
That's right. And we've focused on the feet and some of the neuropathy. That's just one of many symptoms that diabetic folks have.
Oh yes, and to be fair, that's what we focus on, so it tends to be a major focus of what we do. There are a lot of other problems, and the major ones is blindness. Diabetic or retinopathy is one of the major causes of blindness in America. In fact, it's pretty much number one. Kidney issues that happen, they slowly lose function in their kidneys over time. Vascular disease is major. In fact, once they have diabetes, that's what we call a cardiovascular risk equivalent. That's the same as having smoked for a really long time and having already had a heart attack. Having that diabetes puts people in that category because the chance of clogging of the arteries in their brain, in their heart, in their kidneys, and for our purposes, in their legs is so much higher.
And leads to things like stroke.
Very much so, very much so. the clogging of the arteries of the legs is one of those things that's so often overlooked. Everybody's heard about stroke. Everybody's heard about heart attack. They all know that happens with diabetes. If you have a patient between the ages of 50 and 65 who has diabetes, 30% of that population has significant clogging of the arteries in their legs, and they won't really know it. And the other sad statistic is only about 30% of their primary care providers know about it. So you don't look, you don't find, but it is a major risk factor, and it's important for people to be aware of that. The clogging of the arteries is a major game changer as far as their health. And the stroke can be a major life-changing event, the heart one can, but losing that limb as well can also be a life-changing event that changes their ability to function. If you have to lose a limb in your leg, it takes 30% more energy for you to walk just by losing that one leg. So when you have a population of people that are aging and say they're already at a point where they use a walker, if they lose a limb, they're not going to walk anymore. And once they don't walk, it's hard for them to stay in their own home. It's hard for them to enjoy the things they used to do. It's hard for them to take care of their activities of daily living and shop for themselves. It's a big game changer.
Right. It really affects their quality of life significantly. Yes. So what can people do, first of all, to identify if they are at risk or if they already, in fact, have prediabetes or diabetes? What should folks be doing?
Now, the best way to do that is to get a regular checkup, and I know you hear that a lot, and sometimes people go in and get their checkup and say, shoot, nothing really happened today. They told me everything was fine. I guess I'll go back in 5 years. Reality is those things will happen very, very slowly, and the process that is diabetes starts compiling long before those tests start to become positive. Like I said, most people have had that process for 10 years before they get diagnosed. Going to the doctor, getting that simple blood test once a year, especially if you have a family history, if you have a mother or a father with diabetes, a sibling with diabetes, or any of those other risk factors, inactive lifestyle, overweight, especially the family history, because the genetics is the major driver here. All of those things together, just getting that regular test, we'll find it long before people start having major problems. And the blood test is really a simple one. We have a couple of versions that we use, but just a simple fasting blood sugar can make that diagnosis very quickly.
And I'd like to mention also that people should tell their doctor if they're having any signs of diabetes. Don't wait for them to find it on a blood test, right? If you are having a symptom that you're worried about, don't be afraid to go and mention that to your healthcare provider.
Very much so. And sometimes those symptoms you'll interpret as entirely different things. But when people come in and say, gosh, I'm thirsty all the time. Gosh, I feel run down. All these things that seem fairly benign or could be related to something else, it's important to mention them because they really can become something that's much more serious. And I can't even tell you how many times I had people come in and complain of weakness in their legs, tired all the time, thirsty all the time, needing to go to the bathroom frequently, had no idea, it was never on their radar that this might be diabetes, and within a few minutes we had found diabetes.
Right, so keeping that open dialogue with your healthcare provider, making sure that you are adopting a healthy lifestyle to reduce some of those risk factors. Where can people go to learn more about diabetes?
There's a couple places where you can go. Number one, diabetes.org on the computer really is a great resource. There's a lot of information there to help people not only that have diabetes, people that think they might have diabetes, people that are trying to avoid diabetes, and the caretakers of people who have a family member with diabetes. The resources are really fantastic and just really worth exploring. The hospital also has education materials and education seminars that they put on for those that have diabetes or going that direction, think they might have diabetes or just concerned about it.
That's a class that people can attend at the hospital about diabetes.
Yes, and I've actually gone to lecture at that class. It's really a fun time, especially as a provider, because I get to explain what is diabetes, how does it happen, what do you look for, and it's very interactive. We did a lot of question and answer. Everybody had something to add. It's really a well-spent hour.
All right. Dr. Johnson, thank you for coming today and sharing with us a little bit about diabetes. It is Diabetes Awareness Month. This is a really important message for people to get.
Great. Thanks, Cortney.
Thank you so much. And thanks to all of you for joining us for this week's edition of It's Your City. I'm your host, Cortney Bloomer, and today's episode was brought to you by Paradise Salon, Spa, and Wellness. If your business would like to sponsor a future edition of It's Your City, please contact Darla at the address shown on your screen. Have a great week.